Your worship.
Please address court on the health concerns that your counsel just informed the court.
Thank you, Your Worship. I'm in possession of a medical report from Lukwago Hospital here, made by senior consultants, 5 senior consultants. These consultants include the senior consultant on orthopedics and spine surgeon, with the team leader Norbert Oworth.
I beg your pardon, senior consultant of
orthopedic and the spine surgeon, Dr. Norbert Oworth. I have senior consultant physician, a cardiologist, Michael Mugoma. I have a neurologist, senior consultant physician, Stephen Matovu. I have there is also a consultant neurosurgeon, Joel Chiyawiri, and associate consultant orthopedic and spine surgeon, Dr. Edward Chionde. These are senior medical consultants who were tasked by the executive director, Lukwago Hospital, Dr. Rosemary Vianima, to examine my state of health. I spent a whole week in Lukwago undergoing specialized investigation and some interventions that could be made within the capacity of Lukwago Hospital. Your Worship, it's a detailed report which is on record of court, because I can see court received it on 1st July. It's addressed to the Chief Magistrate. It's dated 30th June 2026. There is a forwarding letter written by Dr. Vianima K. Rosemary, the Executive Director. Your Worship, after thorough examination, they established that I suffer 5 chronic health challenges. 5 chronic health challenges, which are very, very serious. And as we speak today, my life is in danger if they are not attended to. I have a problem with the breathing. They mentioned it here. I have a lung complex with what they call residual mild cylindrical bronchitis. Which is a permanent damage on my lungs. And once I'm in a place with limited oxygen, I suffer breathlessness, and that's why here I was gasping for air, because the windows had been closed and I was not breathing well. And they recommended that I should always be in a well-ventilated environment, because of that pulmonary challenge. It's called my current pulmonary functional tests, which they conducted, indicated that I need that kind of environment. My Lord, the second one is that I have a residue cervical radiculitis following a cervical 6-7 disc replacement surgery and the adjacent level C5-6 disc disease. That is the cervical problem I am enduring ever since I underwent a surgical operation on 29th of April 2024, which I have been nursing all through. And these senior consultants have strongly recommended, and I want to read the verbatim their recommendation after that finding, that Lukwago should have a spinal review by his primary spine surgeons in India to re-evaluate him for the persistent upper limbs radiculitis. It's a medical term. That they were unable to repeat the MRI investigations because they were not certain of the compatibility of the implants, the artificial disc that were used for his primary spine surgery and MRI scans. So the point here is, when they conducted an anterior cervical dissectomy with a disc replacement at C6 here, the nerve root at the spinal cord, there was an implant, an artificial disc, which was inserted here. And when I went to Mulago, after conducting the investigation, they did a CT scan, they discovered there were attendant issues which had complicated this situation and required further examination and urgent attention by the neurologists and neurosurgeons who conducted the surgery in India, and that is immediate. It's urgent. So I was put on some kind of therapeutic treatment. They gave me pregabalin, at least to contain the excruciating pain I am undergoing. I am facing. That excruciating pain is being mitigated by the use of some medication, part of which is pregabalin, and of course some scrubs like Fofastum and others. That is the second one, Your Worship.
That is not it.
The third one, Your Worship. Yes?
I said that is not it.
I was saying that one requires immediate evacuation to India, and I should be in India by now. I need to be in India now, if my life is to be saved. Others have been condemned to death. And there is a limit, Your Worship, to using of these neurotherapeutic, whatever, medicines like pregabalin are interchanged with gabapentin.
The jurisdiction in law relates to trying a matter. In my humble submission, nothing limits your power to hear. I am sure that you would be interested in knowing why the accused person has not appeared. Conventionally, the file before you has a record of poor health, and the court would be interested in knowing the state of health of the person that was sent to hospital. Probably that's what you wanted to address court. I would still implore Your Honor.
I beg your pardon?
Yes, this person was referred to hospital by this Honorable Court. He's not in court, and I must say that even the presentation on Zoom was a clandestine move.